Vinay Bhargava, who's the co-founder of Mytonomy. And so with that, let me bring Vinay on. Vinay, if you want to open up your mic and camera there.
How are you, Steve? Thanks for having
Great.
me.
But I'm still kind of off balance because I didn't open my mic up and I was babbling there for a few minutes. Usually after doing this for a year, that doesn't happen to me, but it's great to see that I don't have my Zoom protocol 100% dialed in. But Vinay, I'm really charged up to have you on our discussion today. I don't know if it was a news item or a press release, but I stumbled into your organization and I just saw the connections to our community from the perspective of, healthcare, telemedicine, aging, and I believe you're a DC based company as well.
We are.
But before we dive into Mytonomy, let's help our audience get to know you a little bit. Tell us a little bit about your background and kind of your career and what led you to Mytonomy.
Yeah, thank you so much, Steve. It's a pleasure to be here. Yes, we are a Bethesda, Maryland-based company. I'm actually from Rochester, New York. I grew up there. My parents immigrated from India in the 60s and eventually settled in Rochester. I've had a lifelong love of visual communication. So I went to Purdue to study electrical engineering. And then after graduation, came back to Rochester to work at Eastman Kodak, which I bet folks still recall. I like to call it the Google of the 1880s. I learned a lot of great product development at Eastman Kodak. And in the mid 90s, when I was there, the internet boom was just starting. The web browser had come out. And I asked myself, how do I get in on that? Because I had this lifelong love of visual communication, publishing, and now it was intersecting with technology. And so after a couple of years at business school at MIT, I went out to Silicon Valley, where I worked for 9 years from 1999 to 2008, including a great stretch at Google. And so I was very fortunate to join Google in 2003. I learned a lot. I saw the company grow tremendously. I ate a lot of free lunch. And I eventually left 10 years ago to start Mytonomy, initially in the K through 12 edtech space as a learning platform for college counseling. And about 6 years ago, we saw a tremendous opportunity in healthcare, which I'm sure we'll cover in this discussion. And so we entered healthcare, and now we're only a healthcare company. And a lot of folks have been calling us the Netflix of healthcare. So we'll get into that, but really excited to be on your show today.
Great. And, I just filled out my March Madness bracket.
Yes.
And it looks like Purdue is got some pretty good odds for this March Madness. So it's going to be an entertaining month for you, I'm sure.
They're a 4 seed. I think the Big Ten was really tough this year. So I picked a lot of Big Ten teams to go for.
Yeah.
So
it's amazing how important sports are in this pandemic when we're not able to go out and do other activities that we used to enjoy. So, okay, well, this is great. Really interesting background. And man, you've been on the cutting edge of this tech movement here. And but let's dive into Mytonomy.
Sure.
And feel free if it's helpful to share your screen or anything like that, you can do that. But just I'm curious to learn what you're doing in this space and how we can participate.
Yeah, absolutely. So let me just tell you what we're about and why I think we're certainly relevant for this community. So, when it comes to their health, people spend 99% of the time taking care of themselves outside of the doctor's office, right? So you're only less than 1% of your time is in the hospital or in your doctor's office. The problem is that the US healthcare system was not designed for this. So not surprisingly, kind of care is fragmented, inconsistent, and expensive. And so Mytonomy is flipping this problem on its head. We empower healthcare customers like health systems, insurance companies, pharma companies to give their patients what they need to take care of themselves in the palm of their hand. And so we call this asynchronous virtual care. And so think of it as like Netflix meets Salesforce with a special data model, right? So we're using video to engage people and to communicate and to help folks understand what to do next in their health at home.
This is great. So it sounds really good, but you know, you'd mentioned that you're passionate about visuals.
Yeah, let's see
I
one.
am too. So
Okay.
it's sort of like, what does this look like? How
I
does
know.
this operate?
Let me stop teasing you guys. So I'm going to take you through a demo account, but I also just want to, this is our homepage, mytonomy.com. We have a lot of information there. It is very visual. What we provide to a hospital, and this is a demo system for a fictitious general hospital. Hopefully all of you love soap operas. So in this use case, let's consider a patient called Kate, who is about to have knee surgery. And she's a little anxious about it, not sure what to do. And so her doctor will send her an email saying, hey, I'd like you to watch these videos. They've been approved by me, and I think they're going to help you prepare for your knee surgery. And so Kate can log into this site. She does not have to download an app. So this is what tech people call a mobile responsive site, which means it can work on a cell phone. It can work on a desktop. You don't need an app. You just need a web browser, right? So Kate's going to log in, and she's taking to this very easy to use interface where in this demo account, unfortunately, Kate has a lot of health problems. So there's more than just knee surgery here, but there's knee surgery, PT, breast oncology, and lots of other things. But if Kate wants to learn more about having knee replacement surgery, she can click and watch some of these videos, which have been professionally made.
Share these videos.
Sorry, I'm going to pause that. They've actually been created in Mytonomy's Bethesda, Maryland film studio. And so while our CEO, Anjali Kataria, and I have backgrounds in software, we decided to build our own studio and recruit some great people who know this stuff. And we've created 2,000 micro learning videos that are short, videos that cover just one topic, videos that are in both English and Spanish. And these are available for folks to be able to prepare for an upcoming procedure. And in this demo, for folks that can see it, we're talking about having a knee replacement. And so what Kate would do is she'd watch these videos. She might get surveys. Her doctor may ask her questions through a survey tool. And then based on her responses, we can actually personalize additional videos and or send her text messages around, be sure to schedule your appointment, or here's a link to do some PT. But it's essentially personalizing that care journey for her without her having to go into the hospital. So I'll pause there for any questions.
Wow, I love this. And as you sort of display this, you can see how broken the current the traditional system is, in that dialogue is often, a doctor is under tremendous pressure to kind of, you go into your doctor's office let's say, knee surgery, and the doctor and his staff are trying, or her staff are trying to sort of cram all this information into your head. They hand you a million brochures.
That's
and
right.
Do it in a short period of time. And then you have to make decisions at that same time, or at least you think you have to make decisions. Totally
Steve,
another topic.
It's the worst time to actually think about your health because you're scared and you're anxious. That's not the time to teach someone, right? So this allows playback. You can hear it once from your doctor in person, and then he or she can say, hey, Kate, go watch these videos when you get home and you're a little bit more relaxed. So we're really trying to replace those bad handouts, right? Because those aren't cutting it. And a lot of people use YouTube as a giant how-to guide, but sometimes there's inaccurate information out there. And of course, who wants to figure out which videos are accurate and which ones you shouldn't click on? So we've done all that for you, and we've actually created the videos ourselves. I was just going to show you this short video about getting in and out of the car with a walker. They're very specific.
No, this is very relevant to our audience. So this is great.
Can I play 20 seconds of it? We won't.
Absolutely. Yeah, okay. That's great.
Yeah. So
we're going to back up until we feel the car on the back of our legs. Once you're here, I want you to reach for the car with one hand and the dashboard with the other. I don't want you reaching for the door because that can always swing toward us. When we're
So this is a licensed physical therapist with an actor, a patient actor, showing how to get into a car when you have a walker, which is a very practical skill, right? And so this
Oh
is
yeah.
like a step-by-step how-to guide that not only if I was getting a walker, I'd want my caregiver or my spouse to learn about this too. And this system is designed to be able to educate a bunch of people virtually. I would just
Mhm.
add, Steve, where many of your viewers or members have probably experienced telehealth, where you get, a Zoom visit with your doctor. So that's great. The challenge is they're still only 15 minutes long, right? And so
Yeah.
you still can't get all your questions answered. And in fact, they often don't have the wraparound services that if you're going in person, you could have a little sidebar with the nurse, ask her some questions. Maybe the person at checkout could answer some of your questions. In a video visit, I believe it's a little bit more cut and dry. You get your 15 minutes of fame with a doctor, and then the camera's off, and you're left by yourself.
Yeah, I mean, the we've seen some tremendous benefits of these video visits because you get that 15 minutes, but still it's only 15 minutes. It's a lot better
And
than
nothing.
the hurried doctor in the office who you were supposed to meet with for 15 minutes and it turns into, 5 minutes. But no matter what, this is really opening my eyes to the value of and the fact that people can watch these in a setting that they're comfortable in, they can digest it, they can rewind and fast forward. And I also like your comment about um, the the fact that it's curated in partnership with the provider, whether that be the hospital or the other healthcare provider, versus just sending people to YouTube, or worse yet, it's sort of like I've done this on a regular basis. I'll find a YouTube video that I think is relevant to try to help somebody through a problem, but then they're in the cycle of YouTube videos.
Yes.
So it's sort of like they might listen to the one that I think is good, but now they've listened to 4 or 5 more, and their head is full of all different points of view.
So YouTube is a wonderful platform for a lot of things. I'm still a fan, even though I left Google, but it is not designed as a training system, right? One of the things people have told us is they love the fact that our interface has a beginning and an end. Because unlike funny cat videos, you actually don't want to stay here any longer than you have to, because no, no one likes to be sick, right? It's not like I want to spend my time in this example on what I'm showing is breast oncology and kind of understanding a diagnosis. And you certainly want to understand what's going on. But once you've felt that you're done, you actually want to go on with the rest of your life. And the problem with the open internet is exactly what you said, is like their business model is to hook you to watch ads and to stay on the site as long as possible. We just want you to understand what you need to do, and then you should leave. We're not selling you ads. We're not here on, it's not a viewership based model where people pay us more if people watch more videos. Basically, the hospitals, depending upon their size, will license our software and our content, on an annual basis. It's what's called software as a service. And then they make it available at no charge to their patients. So the incentives are aligned with our business model and what we're trying to do. And I think that's where the broader internet the wheels have fallen off a little bit, because in their quest to be good capitalists and make a lot of money, which is great, I think they've lost their North Star a little bit about what's the right thing to do when it comes to content moderation.
Yeah, and Audra Bakaitis and you just touched on this, but I'd like you to dive into it a little bit more. She says doctors' offices and hospitals should have this info available in their offices too. Tell us a little bit about, so your customer, your ultimate, the customer that you're developing a relationship with is hospitals, doctors' offices. Are there any others?
Yeah. So
then ultimately, this is a tool to help improve the communication and care with their patients or their residents.
yeah, I would say anyone who's involved with either the delivery of care or the payment of care could be a customer. So it could be, the obvious suspects are doctors' offices, health systems, But then you get into retail. And if you look at what's supposed to be happening, and I think will be happening soon, is the big retail chains like CVS, Walgreens, et cetera, are going to be the forefront of delivering a high volume of COVID-19
wow.
vaccinations. And so you could have a poster at your local CVS, which has a QR code that someone could scan with their cell phone, and that would lead you to a site like this. In fact, if you go to our website, at the top, we talk about this word broadcast, which is hyperlinked. If you click it, you'll see an example of our content for COVID-19, which has been vetted. And it's in English, it's actually in Spanish as well. And this is all free. So you can get to this from our website. But imagine if like CVS or Walgreens had this as well, or Safeway or Giant, everywhere they're doing COVID-19 vaccination. We'd love to partner with those folks and make it, a one-click access to this content.
Since most of the people that are on and listen to our discussions are senior care providers, and we have a tremendous link between our community and hospitals and healthcare is that oftentimes a fall is what puts somebody in the hospital, and then they enter our little world. And so obviously if the hospital has your platform, that's great. But have you begun to forge relationships with senior living communities or home care agencies or any of those types of providers?
We're very open. I mean, the short answer is not yet, but there's no reason we can't. We're available at info@mytonomy.com if anyone wants to reach out. But we are a growing company. We're in the midst of raising our next round of investment. And I think with additional staff, especially in sales and marketing, we'll be able to reach out to these other channels that you've mentioned.
Well, yeah. And so, you've thrown so much at me, I'm kind of like all over the place. Yeah. But one of the things that I wanted to circle back on is your ability to create high quality, informative videos. Yep. And you mentioned you've got 2,000 in your
library,
your current library.
Yeah.
Let's assume that, because I could see with nursing and rehab centers, with home care agencies, with assisted living, where having a platform like this to be able to sort of steer your new residents or your new clients into this could, the thing that I like about this is that it makes, we oftentimes find that expectations and what is actually delivered, that there is a miscommunication here, in that the company is saying, or the hospital is saying, this is what we're going to do, and if you follow these steps, you're going to have a good experience. But the end consumer is not seeing that and you're hearing that. And so I see this as balancing things out. How easy is it for you to create this custom content for a specific category?
So it's relatively straightforward, because we have great employees that do all this, right? So we have, if you look at, so before we got into healthcare, I didn't know how, videos were necessarily made. I thought I had I had my iPhone. I thought I was a videographer, but not really, right? So we have people who are subject matter experts in senior aging, in chronic disease, in cardiology. We have a doctor on staff that has recruited hundreds of these subject matter, medical experts. They're not all employees, but they're folks that vet our scripts. So we have script writers, and then those scripts are produced. And there's a mix of different types of content that we create, whether it's like a live clinician shot, or animation, or what's called video scribe, where you have, like writing on the video. So from a standing start, we can get a new module out in 3 months. And so it's not huge. It's not a huge time frame. We are trying to create all this content to make it reusable. So while we do custom content, and that is what hospitals really appreciate, is that they may license our knee surgery module, for instance, but then they'll want like 2 extra videos that talk about, well, how is it specifically done at Acme Hospital, right? And so
Exactly.
that little dollop of customization makes it feel really personal to the patient, because it's not just like generic content you're finding on the internet. It's actually been made for the hospital you're at. But it's scalable because we're not like filming an entirely new video or entirely new knee module for like thousands of hospitals across the country, because that wouldn't really work. So thankfully it is, more science than art, but there's a little bit of art in healthcare. And so we make the custom videos for that part.
Yeah, and I think what I like is when I saw the video of getting in and out of a car with assistance is that we're all telling all of our customers the same thing.
That's right.
And sort of, I think the secret here, and this is where our community may interact with you and create some dialogue. If there's what I could see is that if like that video could be helpful to our field, and we could probably go through your library and pick out probably, several dozen more. And now all of a sudden you've got this content that your organization can share with your customer base and just improve that customer journey. I love it. Like you think about it. Every hospital is out there saying the same thing to every discharge. And that's a great clue of where video content should be created.
Absolutely. So if you look at where technology has impacted other industries, so think of, I remember being a paper boy in Northern Illinois. I delivered the Chicago Tribune in the late 70s. And when I was actually paid in cash, I go to the bank, right? You go into the teller and you fill out the ticket and you make a deposit. And now we do a lot of that stuff through an ATM, right? So what happens in healthcare, and look, healthcare is a humanistic industry. We should never forget that it is about human connection, not about computers. But there are things that computers are good at. Computers are good at repeating the same task at the same time with a high degree of reliability, right? So if, every time there's a newborn baby, if you're going to say the same instructions to that mom on how to put in the car seat, you can still say it in person, but you can, prescribe it and have her watch it on her phone. If you're going to tell someone who just got a hip replacement how to use this walker, you can show it to them, but you can give them this video to watch when they're at home, because they'll be able to repeat it. They'll watch it at their leisure, share it with their husband, and just it'll reduce the anxiety, right? And so if you just think about it, like a pre-pandemic, if you're going to book a spa or vacation, that hotel probably shows you more about what the spa looks like than your hospital does about what your operating room is going to look like, right?
Yep.
So let's try to bring healthcare into the 21st century together. I think we can do a lot here.
Well, and there's also, you're talking about things where from an owner operator or manager where there's liability issues too.
Yes.
It's sort of in that that walker example is that, okay, we go out and we train our staff to train our customers on how to get in and out of a car. But somebody's having a bad day, somebody doesn't do it right, somebody skips some of the key components here, and all of a sudden there's a fall in our parking lot. And, depending on the mindset of the customer, that could result in a lawsuit and some liability and what have you. Is that what I like is vetted standard instructions that are clear. The customer can rewind it and go back and then learn exactly what they're supposed to be doing at this process of their treatment. It's one of these sort of like aha moments, and it's great to sort of see you bringing this technology to our field. So let's see, any other bells and whistles or calls to action that we can sort of introduce our community of older adults, their families, and senior serving professionals?
Well, I would just comment on that last use case around liability. Of course, we hope it never gets to a lawsuit, but they happen. I mean, they're not rare in healthcare. So other added benefit of our system is that when someone logs in, we have, patient level tracking of what they watch. So if, you showed me the walker how-to video 2 days ago and I watched it on my phone, and then 2 days later, you know, I claimed that I was never trained. Well, you might be able to point to that record to say, hey, actually, I think you may have just forgotten, but we prescribed these videos to you a couple of days ago, and it looks like you watched 10 of them. So it kind of gives you that liability protection because you have proof that you did go that extra mile and actually assign people trained content.
Yeah, and it also makes the customer experience a lot better, because what I've found is oftentimes it's sort of, receiving treatment and care, it's a team effort, is that, if the customer goes through these steps, their experience is going to be better. And so often, more often than not, it's kind of like, okay, you didn't do this, you didn't do that, and that's why the outcome isn't where it is. So this is pretty cool. I'm wondering, as we're chatting about this with hospitals and care facilities, is there a team training portal that you guys either offer, that you're working on? Because as we're listening to this, it's sort of like, okay, part of this is also could be our staff sort of knowing and understanding all the components that we're sharing with the customers.
Absolutely. So we have an adjacent staff training portal. It's basically the same infrastructure as you would suspect. Some of the words are different. The nomenclature is about staff, not patients. But you can assign training to your staff and also see who completed it, right? So it's kind of a one size fits all piece of infrastructure, because one of the things that's happening in healthcare, there's a lot of interest in digital health. So everyone and their mother's coming out with like new tools, and there's all these like one-off point tools that, hey, I do staff training for orthopedics. Okay, great. Well, I do patient ed for orthopedics. Okay, that's something different. And then for diabetes, I have this different tool. So Mytonomy's gotten some traction at major healthcare systems because you use the same system for all of these use cases. And so the RO, you just get more bang for your buck. I was just about to show here, you asked for more bells and whistles, Steve. Integrated surveys are a cool feature. Like surveys by themselves, not super unique. Everyone does surveys. I'm not here to talk that up. But what's interesting about the way we do surveys is we can have a video about the survey to first preview, because, in healthcare, they're just always sticking that clipboard in front of you, right?
Yeah.
And it's like the same questions. There's not a whole lot of context. Like, why do I got to answer these again? So we can give someone a survey here in this example about the WHO's survey, which is about hip pain. And you can actually fill it out. It kind of is integrated into the experience. And then at the end, you can actually, let's see if oh, that was me. So it can actually personalize what videos, will be assigned to you and which ones you haven't watched yet. So
based on the way that you answered those questions.
That's right. So it learns, right?
We call
it.
Yeah.
Yeah. It's a common, there's this thing in ed tech called adaptive learning. It's a concept that has been implemented for, K through 12 college kids, but there's no reason it's not widely applicable to patient ed. So you might have people that have had diabetes for 20 years, 30 years. They kind of know a lot. And so they don't need the basics, but you might have someone who's newly diagnosed. And so how do you tailor education based on, their baseline understanding?
Looks like you've got a lot of good content with COVID-19, which is fantastic, because I'm sure that hospital and medical staff are repeating themselves over and over and over again, and the ability to share that. One thing that we, recognizing that most of your customers are health and hospital systems, I'm nervous about asking this question because a lot of our providers out there could benefit from having a platform like this, but I'm kind of wondering about the cost range of, like, let's say that I run a home care agency. I could see where being able to tap into a platform like this would be pretty unique and interesting. But what type of costs would I be looking at?
Yeah, so it really depends on the size of the patient population that you're addressing. I think we've tried to make it easy to get started with us. You don't have to buy, everything right away. So think of it as, if you were just concerned about orthopedics and certain senior care modules, you could think of it as a small. We like to think of it in terms of shirt sizes, small, medium, large. You can think of yourself in the small category. If you had the need to deal with chronic care and a wide range of comorbidities, maybe you're in the medium. And if you really are like doing post-acute surgery rehab and a lot of more serious things that are expensive and have penalties for readmission, maybe you're in the large.
Mhm.
And then it really varies. I mean, listen, I think for healthcare systems, if you're a hospital, you could get started for as little as 50K, which is less than a full-time staff. If you're, a home care agency or something, I think you'd see us be very flexible. I think it's really about what's the use case that you think could justify the investment,
Mhm.
and do you have the interest? Because it's pretty easy to implement, but it just does take. It won't implement itself. So you need someone
Yeah.
to be a project manager and assign it to customers or patients, et cetera, et cetera.
Yeah, and where I think the where this could make a lot of sense is in like we have a lot of our multi-location providers. So, a company that might own 24 nursing homes, you
Wow.
could see where, think about like the intake and the discharge
Yep.
is this process. And if you could take a certain percentage of the dialogue that's going on
Yeah.
between the social workers and the clients and standardize it through a platform like this, it could, like you said, I like the idea of you're saving a staff member a
Yeah.
full year's salary.
That's how
Yeah.
you should think about it, right? If you're running 12 nursing homes and you could get a system for the cost of a staff member to reduce, potentially basically free up more than one staff member's time annually, what's that worth, right? So that's where you can use technology to automate and take the redundancy out of the provider or the staff's lives. I mean, they're human too, right? I mean, I don't think anyone likes repeating themselves for 8 hours a day. And so you could still have them on staff and have them just do higher skilled things and kind of delegate some of the onboarding and offboarding, at least a lot of it, to a video-based system.
Man, I love it. Well, I tell you what, this has been really informative, really intriguing, and it's just, I love your story. I love the fact that you're here local in the Mid-Atlantic with most of our audience, and the what I'll sort of throw out a last call with any questions and comments to the audience, but uh, but what I'll, and also as a reminder, I'll share the recording as well as Vinay's contact information so that if you're interested in this platform for your base of customers, you can learn about it. Do you have a list somewhere of the medical systems that are using this? Because I could see like if one of our residents or clients
Yeah.
needs to go to the hospital, it's like, oh wow, you're gonna love this platform that they use over at General Hospital.
Yeah. So a lot of our customer logos are on our website.
Okay.
Not all of them, but I think, so it's not quite in the Mid-Atlantic, but Carillion Clinic, which is down in Roanoke, is
Mhm.
one of our big customers, and also so lucky to have their CEO, Nancy Agee, be on our board. Um, and then we have systems all over across the country, still trying to work the Mid-Atlantic. So, if
Right.
folks liked what they saw, tell their doctor to give us a call. We'd love to partner with them.
Yeah, and that's the point of these discussions, and it's just a reminder for our audience too, is that one of the things that everybody has responded really well to as we've been doing these is just introducing new technology new ways of thinking, and the fact, keeping a wide field of vision, like Vinay, your story just in and of itself is a great one of where you sort of started using this technology in education and then discovered that, wow, this is where I can really make a difference. And so just helping you get the word out about this powerful platform, but also a reminder to all of us to just, the good ideas are out there, and you can sometimes trip over them on your way to doing something else. And Mytonomy is a great example about that. Let's see. Cordell Martin says, is there an opportunity for the consumer to dial into the database, or does it need to come from a provider?
So today it does need to come from a provider. We don't have a direct to consumer model. I've thought about that a lot, just coming from Google. What I would say is, when you open it up to direct to consumer, you do have to just find a way to pay the bills, right? And so either you end up charging consumers or you end up advertising. And we wanted to keep it free. And obviously it does mean that, your doctor needs to provide it for you. The other thing is that one of the reasons we're so big on going through providers or doctors is that's where the trust is, right? As much as I love Mytonomy, you guys hadn't heard of it before this podcast, right? So like, why would you trust us? I mean, let's be honest, like we just showed up. So you trust your doctor though, right? So if you get it from your doctor, it's going to be more impactful than just finding it on the internet. That's our thesis. And there's a trade-off because we know it can make it, it's going to take some time to get to everyone.
Well, the senior serving professionals in the audience know exactly what you're talking about, because as much as we are providing these wonderful services to help people through their challenges, because most of our services have this aging and senior living attached to it, there's resistance. But when somebody that they trust recommends, hey, you should give Cindy a call over at Shady Acres, all of a sudden it has a little bit more trust. I also sort of feel like what I like about the providers sharing your content is that it's that a dialogue can be had about that content versus just a random consumer stumbling into it. But who knows? I mean, again, it's a rapidly moving world, and a year from now, you may have sort of figured out where you can share some of your content in a meaningful way.
Yeah.
Let's see. Cordell has another follow-up. Can multiple doctors or providers team up and make the cost effective for small? Oh yeah, this is a great comment. Yeah. Like sort of a collaboration. Would
Sure.
you be open to something like that where, what I could see is like a trade group, like a trade association, sort of licensing your platform so that all their members could use it. Have you had any experiences like that?
Yeah, absolutely not exactly in that way, but in the same basic model. So let me tell you what we did with Sanofi, which is a global pharmaceutical company based in Europe. They, a couple of years ago, this is ironic because this is pre-COVID, right? They were trying to get rid of flu vaccination hesitancy in Europe. So in Europe, there's a lot of resistance to getting the flu vaccine, right? And what their thesis was like, look, if we can get the caregivers in Europe to get their flu shot, then they can kind of have this, hey, I am vaccinated campaign, which would encourage other providers to get their flu shot. And then eventually, the thinking was they would then pass that on to their patients. So there, Sanofi and an organization called Connecting Nurses, which is essentially like a trade group in Europe, sponsored the Mytonomy content and then made it available to their members. And so, look, we're very mission driven. I quit a pretty good job at Google to start this company. So, and I've never looked back. It's been so professionally rewarding. So we want to reach everyone, and we don't want to let lack of, obvious resources get in the way. We just want to do that in a thoughtful manner.
I love it. No, I could see, and I think our audience might have some connections into some creative sort of applications where there could be shared costs or what have you. Another question just came in. It says, so if you have a pending hip surgery or knee surgery, does this mean that if your hospital or doctor or surgeon does not know about this or subscribes to it, that it's not available? Thanks for a great healthcare service. And I believe
Yeah,
you.
unfortunately, the answer right now is that's correct. That your doctor has to have a relationship with us for the reasons we talked about. You know, listen, as much as I like to think that every knee surgery or hip surgery is done the same way, your doctor may say, I agree with 95% of what's in this video content, but there's this one thing I do differently. So, and doctors, they already deal with that. It's called Dr. Google, right? So it's not like if you don't get to Mytonomy, you're not going to go on the open web and research hip surgeries. It's just that if we come in through your doctor, he or she has the opportunity to bless what you're watching. And then you have extra confidence that, like, if I do this, I'm good.
Good. Well, I love it, and I'm really excited to see the journey that Mytonomy goes on. I really thank you for just a great description of your services, and I'm excited to see if we can integrate with the senior living community. And so thanks for your time today, Vinay, and thanks everybody who attended. Like I said, we'll share this with everybody, as well as contact info for Vinay and his team.
Steve, thanks so much for having me. It was a pleasure. And I appreciate everyone's attention today. I know they could have done something else with their time, but I'm flattered they came to hear us chat.
Friday afternoon, TGIF. Yeah. All right. We'll talk to you guys soon.
Okay. Take care.